Home Health and Hospice Services. This video is about two different kinds of health services people in Vermont can receive at home. The services are for different times in a person's life, but they're under one agency in Vermont called Home Health and Hospice. The first is called Home Health Services, and it is a short-term service at home to help people recover from things like a surgery, an injury, or returning home from the hospital. The second one is called hospice care, and it is for people who have terminal illnesses to help them feel as comfortable as possible as they approach the end of their lives. A terminal illness is an illness that will eventually cause a person to die. The goal of home health services is to help you get back to the level of functioning and wellness that you had before the illness or injury. For example, if you were able to go up and down the stairs before you went into the hospital, home health services will work with you to be able to do that again. Home health services are provided by a nurse, physical therapist, or occupational therapist, depending on your needs. These services are paid for by private health insurance, Medicaid, and Medicare. To receive these services, your doctor will need to send a request to the home health agency. You also need to be considered homebound. This doesn't mean that you can never leave your home. It just means that it is quite difficult for you to leave your home, or that your doctor has recommended you stay home. Your doctor and the home health agency will help you understand the services you can get. It's important to know that home health will visit you at your home to provide services, but will not be in your home taking care of you all the time. Home health has a nurse on call at all times to answer your questions over the phone, but they are not emergency services. If you are having a medical emergency, you should always call 911. The services that home health provides include caring for a wound, giving instructions on taking your medications, and giving you guidance about managing your disease. Home health provides physical therapy services after a surgery to help you regain your strength. Home health also offers services from social workers, speech therapists, and nurses' aid. Your doctor will help you understand the services that you qualify for. Once you've reached the goals you set when you started getting home health services, your services will end. You can receive more home health services in the future if you become injured or ill again, but the home health agency will need to receive a new request from your doctor. If you have Medicaid or Medicare, there is no limit on the number of home health care visits you can receive. Some private health insurance companies put a limit on the number of home health care visits they will pay for. Check with your insurance company by calling the number on the back of the card to see what they will pay for. Ask for an interpreter if you need one. The second type of service we are going to talk about is also received at home, but its goals are very different from home health. Hospice care is not about improving someone's health. It's about preserving a person's dignity and helping them to be comfortable at the end of their life. The focus of hospice is on reducing pain, discomfort, and distress at the end of life. Hospice is paid for by Medicare, Medicaid, and private health insurance. There are some requirements a person must meet to receive hospice services. A person must have an end-stage illness, which means there are no other treatment options available, and the illness is terminal, which means it causes death. The person must also want the goal of the care they receive to be reducing pain and making them feel comfortable, not living longer or curing their disease. The person's doctor must send a request to the Home Health and Hospice Agency. The hospice program can pay for things like medical equipment such as a wheelchair or hospital bed, and medications to make a person feel comfortable, like pain medication or medications for other symptoms. Hospice also pays for services like nursing and spiritual care, visits from a social worker, nurses' aides, or volunteers, and help with taking care of household tasks like laundry or dishes. It's important to know that when a person starts receiving hospice services, health insurance companies will no longer pay for certain health services. For example, if a person has terminal cancer and starts getting hospice services, insurance will no longer pay for chemotherapy or radiation. People always have the right to stop receiving hospice services at any time with no financial penalty. And they can restart hospice services at a later date. The hospice service providers will not stay with a person and take care of them all the time, but they do have a nurse available at all times that people can call to ask questions and get help managing pain and other symptoms. Hospice services are also available in a nursing home or residential facility. Hospice also provides counseling for families or caregivers who are grieving the loss of their loved one for a year following their death.